Hey everyone, this is Dan Cohen with Behind the Headlines. The ongoing Israeli assault has now killed 220 Palestinians in the Gaza Strip. And I am uh, joined today by one of the people who is seeing that on the very front lines. Um, Dr. Sara al-Saqqa is a surgeon at al-Shifa hospital, the largest hospital in Gaza and where the most serious cases are sent. So first of all, thank you for taking time. Sarah's actually at the hospital right now, just taking a quick break.
You're welcome. Hi.
So just first, tell me what you've been seeing today and over the past, several days since this assault began.
Okay. Hello, everyone. And first of all, thank you for having me. Not because of me personally being here, but rather than you caring enough to ask and look for what's really happening and what's really going on the ground. Um, I've been doing the shifts. Well, my name is Sara, al-Saqqa, as you mentioned. I'm a surgical resident in my final year, doing my residency here in Gaza at Shifa Hospital. And ever since the Israeli aggression started, we have been doing an emergency shifts, which is considered Plan B. So we are doing 24 hours and then resting for 48 hours and then coming back again. So I've been witnessing more than 3 shifts until now, and this is the fourth one. Um, it's well, it's clearly not the first conflict and not the first aggression that we witness, but maybe um, as we grow up, we became more aware of the consequences of this aggression and of what's going to happen next. So, regardless of the minority of the cases, we can say that of the minor cases, we know that those minor cases do have a lot of background that they will suffer from afterwards. We have been witnessing a lot of bad injuries, a lot of um, how can I say it? Family. Well, I don't know what's the right word to describe the war crimes that Israel is committing by bombing the house over the heads of the people living inside it and killing an entire family, leaving only a child or a teenager, or leaving anyone, no one, actually sometimes. So we've been witnessing a lot of crimes that we cannot forget and we cannot just move on from. Um, and maybe just the heaviest the heaviest the heaviest situation that we have been through is losing our colleague, our mentor, our teacher, our doctor, Dr. Ayman Abu, and his entire family, actually. That was one of the worst shifts I've ever done in my entire surgical residency, having to say goodbye for him and then receiving his family one after another, um, with only his 16 years old son, Omar, left behind. Um, Sometimes you find the words are useless in describing the way that you feel about the things that you witness, and you feel that you want to talk about it, you want to describe it, you want everyone else to know what's really happening, but the words does not help.
Yeah, I mean that was a really shocking crime. The murder of this doctor was, I believe, the chief of internal medicine, right, at al-Shifa hospital. So one of the most senior doctors. who clearly played such an important role, and
Yeah.
undoubtedly served as a mentor to many younger doctors like yourself. Can you talk about him a little bit and who he meant to the medical staff at al-Shifa?
We can say that he means a lot to all the medical students in Gaza and to all the medical staff as well, because he's head of department of internal medicine in Shifa Hospital, and at the same time he's teaching internal medicine to medical students in al-Azhar University and Islamic University of Gaza, the only two medical schools in Gaza. So he's actually the one teaching the medicine and the internal medicine, and then he also takes part in training the internship doctors after graduating from medical school in internal medicine department. He is also was responsible for the COVID response, well, everyone knew him in Gaza. Everyone dealt with him, knows exactly how hard worker he is, how much he gives his patients, and how much he has sacrificed to the medicine and to al-Shifa hospital and to the entire medical education in Gaza. I don't believe that he had ever hurted anyone, and he was sure always to leave a good comment to everyone. If you read the posts that everyone is posting about him, you would find that there is always something good he told everyone about. He used to encourage everyone to just go on, keep going, continue your training, your residency, continue your education, and subspecialize, come and serve your country. And he dedicated his whole life just for his patients and for the hospital. And then in just 1 second, Israel decided to just bomb his house, and it resulted in the death of his entire family, him, his wife, his children, his mother, his father, and even his aunt and some of his family members, other family members as well. As I said, leaving only his son. So, yep.
Just beyond belief. It's extremely shocking, but not surprising in a lot of ways also when you know the brutality that you're dealing with. Do the other doctors think that he was targeted, or why would the Israelis specifically bomb his house?
I can simply answer this question by asking you to check the list of the martyrs. If you check the list, the people, those who were killed by the Israelis, you would see that more than half of them are children, women, and old and geriatric population. So this is your answer. Like, there is no why they killed them. They just keep on doing their crimes. They keep on bombing everywhere without a specific target. And that what you can actually know from the way that you can see how the deaths are affected, whom affected by their bombs. It's mostly children and women and innocent men, doctors, and even a medical student as well, dentist. So there's no why they have killed this or those. They just do it.
Right. Correct me if I'm wrong that he was not the only doctor to be killed. Is that correct? Can you tell me about?
There's Dr. Mahi as well. He's a neurologist, and he was killed as well at the same day that Dr. Ayman was killed.
Did you know that doctor as well?
Well, not as much as Dr. Ayman, because Dr. Ayman is working with me, used to work with me at Shifa Hospital.
How have the working conditions been in terms of medical supplies and the ability of al-Shifa to handle the number of patients, of cases coming in? I mean, obviously, um, everyone who pays any attention to Gaza knows that the siege, the Israeli siege and Egyptian siege, makes for an incredibly difficult situation anytime there's very limited supplies. So maybe you can talk about the background a little bit, as well as how it's been to treat just the most shocking cases in that context, and also um, in the context of the pandemic that has Gaza has received almost no vaccines, very little vaccines.
I know that I'm not an MOH personal to know exactly what deficit do we have, or what are the stores, how much do we have in the stores. But from working and from just living in Gaza, you can know that we have this deficit, and we have this problem in medical supplies, or let's say medical help. I think 2 days ago they have bombed in front of a Rimal, a primary healthcare center, and it affected the only COVID-19 PCR testing device. And we already know that we do have a defect in the vaccinations, and we do have the Israeli aggression that prevented a lot of people from coming and testing, and prevented the whole COVID-19 situation from being, or from dealing with it in a right way. And this just increased the difficulty of the situation. I don't know if you know, or if everyone know, but Israel have been bombing a lot of houses, have been what can I say? They've been asking people to leave their houses, and some people have been running from the heaviness of the bombs nearby, and all of those people now sheltered in UNRWA schools, and me and everyone else believe that this might be a big health issue in the near future if this aggression did not stop. Every school have more than I don't know the numbers, but from what I saw, every school have a lot of people inside, more than 1,000 or more, even more. Regardless of the usual medical problems that could appear in such crowdness and low hygiene and situations, difficult situations, we do have the COVID-19 as well. We do have the continuous aggression that could at any time bomb any hospital, any school or hospital, because they don't have a limit. So we're just praying that this ends and nothing more happens to Gazans.
I've seen footage of bombs dropping extremely close to al-Shifa. I know there's been multiple attacks on. I mean, there was, as you said, there was the clinic where they had the COVID-19 PCR testing was bombed, and there have been multiple health clinics, multiple health facilities of different sorts bombed. Which seemed, I mean, there's just no way this isn't intentional. I think back to a tweet that the Israeli military put out during the Great March of Return, saying that we know that where every bullet lands, and this sort of thing, as they were, gunning down unarmed protesters by the dozen. and killed many of them and injured many thousands more. So, of course, being that Israel has these laser-guided munitions, these ultra-advanced weapons, and of course knows, the layout of the tiny area of the Gaza Strip incredibly well, to down to the centimeter. It's just virtually impossible. They don't know what they're attacking. So, what are some of the buildings that have been attacked? I know the Ministry of Health also suffered, some damage. So.
Yeah, and one of the doctors that who were working in telemedicine from MOH facility have been injured by shrapnel in his head, and he's in the ICU.
CNN, the international news channel, there was an internal memo leaked that said that when reporting on the deaths of Palestinians in Gaza, the official numbers given by the Ministry of Health, that CNN reporters and anchors have to say the Hamas-run Ministry of Health, which, as if that casts doubt on the credibility of the numbers that they're reporting, as if these aren't all clearly documented. So, how do you respond to that?
Okay, if I was not one of the people working at Shifa and one of the people receiving those who were killed by the aggression and seeing the bodies by my bare eyes and seeing the change in the numbers accordingly in my shifts, at least, I would have responded to that question. But because it's too I say it's like it's just a way that they're trying to manipulate the truth, or trying to find a reason, or trying to find something to hide behind. And let's say, at least for the families that they have killed in al-Wahda Street, for al-Kolak family and for al-Ouf family, we have seen the bodies. We have counted the bodies, and those numbers are true. And those families have been wiped out from the papers, from the official papers. They're all innocent families. We're scared and just waiting for this aggression to end, just like us. And they decided to bomb them. So,
yeah, I mean, it's really characteristic, but also disgusting that CNN would do that to clearly to cast doubt on the victims, as if Hamas is inflating the number of victims, and that these people didn't really die, that they're just made up, when there's no reason to have doubts, other than unless you basically want to do propaganda for the military that is carrying out these awful massacres of civilians, of doctors, of children.
I don't know why would anyone do that, but maybe they just had the wrong papers in front of them, and they just missed looking at the live videos and the live pictures. I don't know how can they make sure more than seeing the bodies and the morgue, and if those bodies and did not make them believe that Israel have killed those people, those children, those families, then what could make them believe that?
Right, they want to deny reality, and I can only imagine if would they call the Israeli Ministry of Health, would they call that the Likud-run Ministry of Health? because this is the ruling Israeli party? Of course not. This is only something that would apply to Palestinians. Um, um, are you hearing anything about a potential ceasefire? What are you hearing in Gaza?
Well, we've been hearing a lot of news coming and going, but we are just waiting for the official parties to say that there is a ceasefire to believe it. So we're just continuing our work until we get a proper notice of the cease.
So in times when there are these major massacres, how is al-Shifa able to, the emergency room, the trauma doctors, how are you able to deal with those number of cases? Do you have adequate supplies, beds, this sort of thing?
Well, the problem that we had in 2014, and we still do face it in 2021 now that we do have a limited number of beds. We have extended those number by putting some beds in the corridor between the ER of surgery and the ER of internal medicine for triaging. But sometimes when there is mass casualty and the numbers are just beyond the numbers of the bed, the patients are beyond the number, we just keep on treating the patients wherever they are, at the floor, at the table, at the bed, wherever they are. We just keep on doing whatever we can to treat those patients and give them the proper care that they deserve with whatever we have.
So there's been instances where you're forced to treat people on the floor, just to clarify.
Maybe not in my shift this time, but I do remember clearly in 2014, me dealing with patients on the floor, and even me with the senior doctor putting chest tubes for patients on the floor, because we did not have enough beds and the capacity of the hospital is limited. So it's something that could be faced whenever there is a mass casualty. The numbers are just beyond the numbers of the beds that we do have. Thank God I did not need to do it this time, at least in my shifts. But maybe in the other shifts, when they received the number was more than what they could, their capacity could accommodate. Yeah.
Is there anything else you want to say, Sarah? I don't want to take too much of your time, and I think we've covered a lot of ground.
I know that no matter how much interviews everyone did, no matter how much videos they have they have captured, no matter how much pictures you have seen, it's nothing similar to the reality, and there's always more and more happening on the ground. And keep on posting, keep on talking, keep on having this issue alive. This major aggression should stop, and people should know about the crimes that the Israelis have been committing. And thank you for having me again.
Absolutely. We'll definitely just continue to get as much information as we out as possible. So thank you very much for sharing your precious time with us and getting the word out. And thank you for your incredible work in the hospital.